Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Contraindications of hormone replacement therapy. Contraindications include breast cancer, uncontrolled hypertension, undiagnosed vaginal bleeding, smokers more than 35 years of age, history of thrombosis, embolism, coronary artery disease, or stroke, pregnancy, severely increased cholesterol or hypertriglyceridemia, in liver disease, or in cases of diabetes mellitus with vasculopathy, or if the patient has migraine with aura or focal neurological deficits. In all these conditions, hormone replacement therapy is contraindicated. Contraindications of hormone replacement therapy: breast cancer, because estrogen and progesterone together will predispose an individual to breast cancer. Second, uncontrolled hypertension. Uncontrolled hypertension, you cannot give estrogen and progesterone because especially estrogen causes salt and water retention. Also, in undiagnosed vaginal bleeding, we should not give hormone replacement therapy because undiagnosed vaginal bleeding can be due to endometrial carcinoma. So if you give estrogen and progesterone or hormone replacement therapy in endometrial carcinoma, then that will predispose or precipitate the increase the endometrial carcinoma. So it is not given. If there is history of thromboembolism or smoking can predispose to Berger's disease, and in Berger's disease or in thromboembolism, there is increased formation of blood clots is seen in the peripheral veins, but estrogen also increases the clotting factors and predisposes an individual to the thromboembolism. So this precipitates thromboembolism, so it is not used. In hormone replacement therapy will derange the lipid profile, and thus there is increased risk of coronary artery disease. So we do not give hormone replacement therapy in coronary artery disease or stroke because giving estrogen will become a pre-embolic condition. So we do not give hormone replacement therapy for coronary artery disease and the stroke. Then it is not given in hypercholesterolemia and hypertriglyceridemia because estrogen itself causes deranged lipid profile and it increases triglyceridemia. So as a result, there is increased triglycerides are seen lot more if you give it in a patient with triglyceridemia. In a patient with liver disease, estrogen, that hormone replacement therapy is not given. Then diabetes with coagulopathy or vasculopathy, it is not given because of the procoagulant nature of the estrogen. Then migraine with aura or focal neurological deficit, hormone replacement therapy is not given.
thank you and thank you for watching.